Welcome to episode 2 of I'm Kevin Ferber, and I've got HPV cancer, and I'm currently going through treatment. And this is week 2 of a 6-week radiology treatment that's happening in Preston, in the UK. And I've got HPV 16 positive. If anybody's on that same journey, they'll know that there's a big difference in those stats. This update, I haven't felt like doing this week because I have had effects, which I'm going to talk about. But I'm still going to continue with this because I'm inspired very much by the people that have given me really positive feedback online. I mean, this is the start of the video. I wasn't sure whether I was going to share my journey. Following the first of these videos, I've realised it is a really good thing for me. It helps me a little bit, but there's nothing better than me feeling I'm giving something back and maybe helping others. I've had some personal emails and communications with people, some close people I didn't know their journeys, and it's been really helpful for me to be able to offer other people advice. So I like doing that, even though it's actually quite shocking how many people I know that have been through, I've got cancer now, and some that are having real battles, but I'm happy to talk, and I know they are. Not everybody wants to be public with it, but I'm happy to do that because it's rewarding to speak to people in the same path. One of the things that's a constant is people saying, stay positive, Kev. It's good to see you positive. And right from the specialist, right from the start, everybody said the big deal with this is to stay positive. And I've not really understood that until today. I'm a fairly positive person anyway, but 2 weeks in, I've started to see some dark sides to it, of how I feel, and I'm realising where the positivity needs to come from. So that's the start of this presentation. I'm laughing because it feels like a corporate presentation. But anyway, a little bit about how I'm staying positive for anybody that is on this journey or they're around people that's going through a cancer treatment. Some of this might help. I hope it does because it's helped me. So one of the brands, a clothing brand that I've started to wear and buy and believe in, has been developed by 2 ex-SAS soldiers. And their mantra, it's called Through Dark, the brand, but their mantra is endeavour through adversity. And this is the simple way that they're looking at life. They don't get a choice in whether they face hardship or not, but you do get a choice about what you do when you face it. So ultimately, when you don't feel like you've got a choice, the choice of how you deal with it is yours. And that, the start of everything for me this week, week 2, has been to start to take the journey to treatment really seriously. The bad weather, as we had on Monday morning, the start of this week, that would be my 6th treatment. Started with bad weather, started at 5:30 in the morning. But what that's made me start to realise now is people at the beginning were saying, you shouldn't really be doing this journey yourself. You need to get somebody to take you. You can't drive yourself to treatment. And I really questioned that. Thought, well, I'm a professional driver. Like, how ill am I going to be? I'll drive, If it's the last thing I'll do, I'll drive. But what I've started to realise is that this whole treatment plan, and especially when the medication or the radiology, because it's only radiology, that takes effect, your mind wanders. It's quite a serious thing that at the back of your mind, there's no given I'm taking treatment, but there is a possibility that this treatment won't be positive. So every day that you set off to that treatment, to drive to Preston and the Rosemere Centre for me, at the back of your mind is a potential negative thought process. And that, to keep concentrating to do something as simple for me as driving, it's actually quite difficult to do. And I'm able as a professional driver to put those thoughts and those stresses into one compartment and focus on driving and do the driving. But I've realised I've had to work at it. And I thought it would be easy to do that. It's not been easy. So I think for your average person, I can well understand that it's good advice not to drive yourself. I'm having my battle to do it. and I'm quite enjoying the battle to do the driving. But it's not for everybody, and I've started to realise that maybe in the last couple of weeks, maybe I'm not going to do it either. So I've taken that seriously. The other side, Steve, this chap here, I did an interview with him a couple of weeks ago, and he wanted to do the East Riding Stages. He's on a cancer battle of his own, and because he spoke so eloquently about his own cancer journey, I thought, well, if Steve can do it, I can do it. So it's because of Steve that I'm putting myself out there. But also the good news is this week, Steve's got an entry into the East Riding Stages rally. And that was his ambition. That's helping him positive thinking. And that's brilliant that he's only just got a competition license and he's actually doing the rally of his dreams. So good luck to you, Steve. I can't wait to see him there in a few weeks' time. During this week, I've met up with a few old friends, and lots of people have contacted me personally, and occasionally somebody came over. I'm purposely not mentioning anybody's names here, but you all know who you are that's rung, and some international people that have rung, and some good friends that have taken me out for meals, and I've enjoyed every part of it. So it's overwhelming. But the ones that want to talk to you about it, they're good people, and not everybody can deal with talking about cancer and the really serious side of it, but some people can, and I appreciate the ones that can. I've been able to carry on working. I'm 2 weeks into this 6 weeks course. I would have said up to a couple of days ago, I didn't have any real negative effects, but it started to hit me. But I can keep working. I've really enjoyed the distraction of working. It's really good to have a focus from my point of view. So I did the Bank of Dave launch. It's a brilliant film. It's a really inspirational film. Great to be around inspirational people. As long as you've got a positive working environment and positive people around you, it's awesome to go to work when you enjoy it and you realise that, you know, I did a few weeks ago when I didn't know the outcome. I thought, oh, wow, I'm never going to go to work again. But I've started to realise that I'm enjoying the time at work. So, and some things I do I'm privileged to do. So really enjoyed working. I can concentrate when I want to, when I am editing. It isn't the same as normal, not because I'm ill, but just because your focus is dwindling. There's a bigger picture going on all the time, but I enjoy the distraction. The treatment itself, most people have been asking me, that not a guarantee, but I started having a face mask. It's what most people are interested in. And with the face mask, that's to pin you down into the radiology position. And that looks something like this. So when you're actually in the treatment, you're pinned to the table and the machine above your head spins around, fires some radiology into the designated millimeter perfect or micron perfect position. And in my case, is treating my tonsils. So it's going into a tonsil inside my jaw. Obviously, there's some collateral damage with that because the radiology has got to be strong enough to take effect, but it's going through my jaw and through my skin. So that's what it looks like. Most people say, is it scary? It's painless. The only thing you've got to get used to is the mask pushing on your face. One of the reasons they say they don't want you to lose weight, it's really important to keep your weight up, is that the mask, the way it pins you down, has to be, it more or less doesn't stop you from breathing, but it's more or less, it's so tight on your face. And it's a very claustrophobic feeling, so you have to calm yourself down a little bit. And I've had to think positive thoughts when I'm in there. And this positivity thing will crop up a lot because if you freak out when you're in that, I can't explain what it'd be like. But I've got used to it. My friend, Andy, who's been through this, told me I'd get used to it. And he's right. Somehow it's become quite acceptable for me. But if anybody told me they struggled with it, I'd understand it. The next thing, as far as the treatment is concerned, the thing that I'm not looking forward to, and the consultants have said this in quite a serious way from the off, is one of the things you'll do is lose your taste. I'm just starting to lose my taste now. And there's a metallic feeling in the back of your throat. My throat's starting to swell up. And I've chosen to try and do this treatment without the feeding through a tube or a stomach stent. Most people feed themselves through the stomach and if you're being treated both sides, I'm only having one side done. It's compulsory that because you can't take liquids down your throat. I'm getting a sense of that now. So although I was brave at the beginning of it, I'm not nervous, I'm positive thinking, but it's becoming a reality that my throat's closing and I'm struggling a little bit. And hence, I've got some new medications. But I was just sharing it with you that I can taste beer, I can drink beer, but it's not. It's hard to explain, but it's not. You don't look forward to swallowing anything, so there's a claustrophobic feeling to taking on any liquids. I'm having to force myself to drink not just beer, but drink water. But talking about positive feelings, me and Zach went to watch Burnley Rovers. Everybody that's a Burnley fan will know that I want to say something else for Rovers, but Blackburn Rovers, big arch enemies. Me and Zach got to be in the away end. It was fantastic, and we won. So you do enjoy yourself, and it's that positive frame of mind. You've got to just forget about your cancer for a little bit and enjoy life. And that's something that you have to work on, and I'm working on it. And with that, I've had one or two people that have had their own cancer journeys, and the person who sent this message to me, if you're watching this, thank you, because it meant a lot to me. And it's that, Kev, just ring that bell loud and proud. And when I first saw that bell, I didn't really get it. I think, like most people, you sort of wonder whether it's a good thing to be ringing a bell. But I've been in the treatment rooms enough now to keep seeing people ring the bell, which signifies the end of their treatment journey. Doesn't mean to say what their outcome is. It's just they come to their end of the treatment. And it's really hard to talk about it without being emotional, because it's so positive. It's so nice to see other people coming to the end of their journey, and the goodwill that's in that room, to see other people surviving and getting through their journey is amazing. So me and Zach will be ringing that bell soon, and that's one of the big things that I'm using as a positive, because I'm imagining ringing that bell. So that's in my mind. Zach's been brilliant, and anybody that's got a 15-year-old kid, this will warm your heart, because for the first time ever, Zach did the washing up. So well done, Zach, for doing the washing up. I didn't even have to tell him to do it. So proud of you, Zach. Every day, keep doing the washing up, son. And we're looking forward to that bell. So I said what my motivation is, which is the bell. The thing I'm going to finish on, which is the most serious part, if anybody's going through this cancer, I probably only had one slightly negative bit of feedback in my emails from people, and it sort of stems from people being on journeys and thinking that whether it's your dietary stuff that you're doing, and I'm going to say that, in fact, I need to take my vitamin D, that you go and do your research on cancer and how treatments go. Everybody should be taking vitamin D, everybody, especially if you're on a cancer journey. When you know the research behind it, it's a no-brainer. Keep doing your daily vitamin Ds. I'm on medication, not yet, I'm not having to take it, but bacterial mouthwash for me is going to be really important, because the saliva glands have started drying up. So not just for fresh breath, but you need to keep bacteria down in your mouth. I'm starting to not be able to move my jaw. It feels like I've been punched a little bit. And then, of which I might have to do that, because I can get a coffee. Those tablets are not going down as easy as they used to. And then some painkillers that we've got coming. I can still take my Huel nutrition, but the one thing with the Huel drinks, a lot of belief in them because of the vitamins that are in it. But I thought it'd be easy. I thought this would be a really easy solution to get my vitamins in. But I can tell you, the thought of swallowing alone, even if it's a soft drink, isn't easy. And if that's a sign of things to come, they're not going to be easy. So you get something from the NHS, which is really similar. Again, the thought of swallowing is just not easy. So I hope I can do it. At the moment, I can. I'm doing the vitamins, and it's the easier way to do it rather than solid foods. But I'm telling you, it's the sheer idea of swallowing anything is not good. Then, so the final side, the serious bit that I was saying to about positive thinking, for the first time, and I've only ever had these thoughts really, really rarely, and usually only off medication. But I woke up a couple of times this week where I really struggled to open my eyes, and the reality of it, it's pretty dark stuff. This, I don't know whether to share it. So if anybody does get this far in the video, and you're and this does you some good, or maybe it's something I shouldn't talk about, but here we go. When you're coming round, starting to wake up, for the first time, I started to see just darkness, just black, and that's really unusual. I don't know what I normally see, but I was immersed in a really dark place, just black, and I sort of knew I had to fight my way out of that, which is open my eyes. But my brain wasn't ready to open my eyes, so something dark was happening. It felt like a really, really serious hangover where you're just scared to open your eyes, and you know you're awake, but your head's throbbing, tinnitus screaming in my ears, and I'm starting to know that I'm not well, but I know I need to get up. But I'm not ready to open my eyes. And in that darkness, I started to think of, okay, this is SAS stuff. This is your mind's got to do you a favor here and get you out of this because your body's not up for it. And then actually, I've got a philosopher, a psychologist who I follow called Jordan Peterson, and he describes that how people get out of depression, or his advice for people with depression. He says, when you see the darkness, you're in the darkest place and you can't see a future. If you look into the future, if you look down that darkest tunnel, at the end of it, you'll see a glimmer of little light. And when you see that glimmer of light, walk towards it. And in my case, that's make that little light brighter in your mind and get that light to come towards you. It's like opening a window. And eventually that light came and the darkness went away. And I opened my eyes, and it's like, if this is what it is, if this is what's going to happen every day for the next 4 weeks or more, it's going to take some positive thinking. So now I know why my consultant said, stay positive, and positive thinking is what it's all about. It comes pretty easily and naturally to me to be a positive person, but I had to work at it on that occasion. So I'm ready for it. I'm ready for the fight. I know how to deal with it. And the positive messages that people send me, I'm going to get through this with your help. And every little bit of goodwill that's sent my way, I'll take it. And any goodwill I can pass on to anybody else, I'll offer it. Hopefully, I won't ever change my point of view on life, because this has given me a massive reality check. And I do take every day as a blessing. So I didn't think I was ever going to say this. I'm not a religious person, but I'll end on God bless and see you soon.